Welcome to another episode of TMI Tuesdays, the women's health podcast where nothing is off limits. I'm Lauren, your new favorite vagina, aka women's health physio, and I'm here to have honest, practical, and unfiltered conversations about women's health across every stage of life. If you enjoy this episode, I'd absolutely love it if you subscribed on Spotify and shared it with someone who might also benefit. Thanks for tuning in. Let's get started. Hello and welcome back to TMI Tuesdays. It's Lauren here, and I'm very excited to introduce my guest this week. I have Jeevan Atwal here with me. Jeevan is a Canadian certified counselor, certified perinatal mental health professional, and mom of two, who is passionate about supporting individuals and couples through fertility, pregnancy, postpartum, and early parenthood. She believes mental health care should be a core pillar of perinatal care and is a strong advocate for providing support proactively rather than waiting until families are in crisis. Through her work, Jeevan combines clinical expertise with real-life understanding to help parents feel empowered, supported, and less alone throughout their journey. So thank you so much, Jeevan, for joining me today to chat about perinatal mental health and why it should be recognized as a core pillar of perinatal care rather than an optional add-on service. I know historically it's been something that people have accessed only after they're struggling. So I'm really excited. I'm also very passionate about this. It's not my area of expertise, but I'm aware of it. So really excited to dive into this conversation. And as physios, we're huge advocates of prevention and proactive care. So excited to dive into this further. So thanks for joining me on TMI Tuesdays today.
Thank you for having me.
Yeah, my pleasure. So I always like to just toss it back to my guest and so they can share with our listeners and viewers a little bit about themselves and how they got into their area of expertise and how your passions have become your passions. So why don't you tell us a little bit about that?
Yeah. So originally what kind of got me into just counseling in general was seeing a lot of family members, community, people around me struggle with mental health and addictions. So that's kind of what sparked the passion at a younger age of just like not really knowing how I wanted to help people, but knowing that this is the area I wanted to move towards after I was done with, high school and going into university and college and stuff. And so, I did a lot of work with kids. I did a lot of work with kids with autism, ADHD, neurodivergency, and then I became a mom and I realized that perinatal mental health was actually a real thing. It's interesting because when you're going through the health system, you'll hear a lot about baby blues and postpartum depression, but I really learned more about how much more it actually is after becoming a mom and experiencing not only the experiences I was having for myself. I did experience postpartum anxiety. I experienced actually anxiety all throughout pregnancy related to the pregnancy, which is never really talked about. And then also postpartum as well, along with a little bit of postpartum depression. And I looked at the community to try to find support, and I didn't see a lot of it, really. So that was really where I kind of started doing my own research, my own reading, and obviously being in the field, having access to training and stuff like that. That is actually when I was postpartum with my second child, now my son. I did the training while he was a newborn, but I really started to kind of get more interested in working with moms and parents and practitioners in the community after having two kids of my own and having a lot of real struggles of my own. So that's kind of how we ended up here.
Yeah, I think we look at pregnancy and childbirth and becoming a parent as this beautiful, exciting, wonderful thing. And I'm sure it absolutely can be, but it's a complete life change for so many people. And people's experience, their birth experience, their level of support postpartum, the transitions they go through in their partnerships themselves.
Yeah.
I just don't think we talk about it enough. I don't think we prepare for it enough. And I mean, I don't have children of my own yet, but I've seen the good, the bad, and the ugly. And I have sort of a mental plan of everything that I think that I'm going to need
Mhm.
to support me emotionally postpartum because I know how difficult it can be. So, as physios, yeah, we talk so much about prehab and in
Yeah.
general, but we're seeing more research coming out about prehab for the pelvic floor and just maintaining your strength and mobility through pregnancy to help your physical recovery.
Yeah.
So, why are we not spending as much time and focus on that mental side of things and emotional side?
Yeah, I think for me especially, I just thought it was so like and I think we have. I was so excited about how far we're getting with mental health. We're like talking about it openly and loudly online and in the community and stuff. And then it was just like, whoa, there's this whole area that I didn't even consider. As a therapist myself, I didn't even consider this might be an issue for me when I became pregnant, mostly because it was still such a hush hush thing in the community. It's like, well, you got the baby's healthy, so you should be happy. That's kind of how the narrative has been in the community, and it kind of just glides over all of those other things. And you mentioned like pelvic floor physio and pelvic health and all those things. And one of my biggest pillars in my practice with moms is that it's not to say, okay, I'm a mental health therapist, so mental health is more important. But it's like, how do we integrate all aspects of our health into a plan so that you can like take care of yourself as best as possible? Because I know a lot of moms that have trouble with the pelvic floor or just like their core in general after having baby. Like obviously these things are going to come up, and that truly does impact their mental health at a very high rate. So it's like, how do we plan for you to maybe see a counselor and go to pelvic floor physio if that's something you're able to do, so that we can kind of help in all the areas?
Yeah, thank you for bringing that up because there is such a strong connection between pelvic floor dysfunction and our mental health and
Yeah.
an inverse relationship back and forth. So, yeah, they should not be exclusive of each other.
No.
And I know oftentimes they're still looked at both of our fields as a luxury. And I think unfortunately part of that is our healthcare system and how it's set up. But maybe tell me a little bit more about, why perinatal mental health should, it is healthcare and should be primary care rather than looked at as a luxury.
Well, I think it's interesting because I think about it like if we were to have, I'm just going to use a C-section because it's the most obvious physical thing that can happen outside of, vaginal birth. We would never look at someone caring for themselves after a C-section as a luxury. You would think like, hey, this is like kind of mandatory for you to, be healthy, get better, heal, be able to, take care of yourself and take care of your baby. And I think now as more research comes out, like mental health complications are like the number one, I think, if I'm not wrong with my stats. I think that's a 2025 stat, but recent enough that mental health related to pregnancy, postpartum, and birth are no, I think it is the number one complication of the perinatal period. Like that is the highest. They call it a complication, and I don't love that word because I think we all experience mental health challenges in some sort of way, whether they're minimal or really prominent in the perinatal period. But like if that's an even bigger, more, what's the word? Like it's more of a prominent concern than, some of the physical health concerns that happen after, which I'm not negating that they're important. But why are we saying, okay, let's heal you physically and then you can deal with all that mental health stuff later? And why are we not looking at like if someone is emotionally well, they are probably going to sleep better. They're probably going to have the eating better or eating more regularly. They're probably going to want to, be spending that time with their baby and not having the intrusive thoughts, the OCD anxiety that comes with the perinatal period sometime. And it's just, I think I still, as a practitioner, I'm not understanding the logic of our healthcare system of how this isn't. Like, how is this not pivotal? Like, yes, there's such a system in place for the physical health at this point. I do feel like, of course, there's gaps in that too. But like, why are we now not shifting in 2026 to looking at like, hey, maybe at that like fertility appointment or that appointment when you go to your doctor and say, hey, I'm ready. Like, I think I want to have kids. What can I do? Why is mental health not coming up in these conversations?
Yeah, that's such a good point. It's still reactive, right? Like, how are
Yeah.
you feeling? Oh, you're struggling. Okay, let's address that now.
Yeah.
But proactively, what can we do in pregnancy? And why do you think it is that mental health is one of the biggest, maybe we'll call it not comorbidity, that's not a good word, but complication or yeah, we need to
Right.
come up with a better word for
Yeah.
this,
I'm
but
like, it's like an outcome, one of the more difficult outcomes of, the perinatal period, I guess I would
yes,
call it.
why is it one of the most difficult outcomes of the perinatal period?
I think that's twofold for me, like when I think about what the reasons are. One is definitely the psychoeducation around it, because I mean, I think we both know as practitioners, like people can't change or learn about or take action towards things that they just don't know that is going to be there or could be there. Like, I just don't think, like you said earlier, we're not talking about it enough and we're making it the taboo topic. So again, that comes to my second point of like a stigmatized thing that's like hush hush and it's bad and you shouldn't feel that way, or you shouldn't have these questions because you kind of just, once you have the baby, that's all you should be grateful for, and focus on that. So I do think if we even just did more psychoeducation within the community, and that could even be with practitioners, right? Like, I know they don't have time to sit down and do a whole mental health session, but they could give out more resources or talk a little bit about, like, even looking into, hey, if you're ready to get pregnant, or you're looking into getting pregnant or doing IVF or whatever the option is for that family, like, something to think about or look into is, how are you going to take care of your mental health? And I think the more we talk about it and the more we reduce the stigma, I'm seeing a positive shift in the community of, like, we are talking about it more, which is so great. But I mean, obviously there's lots of work to be done in that area.
Yeah. And so if you could give a healthcare professional who sees pregnant people, so whether that's a primary provider or someone like myself who's a physio, what would be your recommendation in terms of how we should educate our clients, our patients on this?
Yeah, so I think for me, when I think about like the kind of appointments that, maybe doctors or physios or other healthcare practitioners are doing, I really try to keep in mind that they're there for obviously a certain reason. So like, mental health might not be the main reason they're showing up there. So how can I help other practitioners screen out people or even see warning signs? And even if it's just a referral or physiotherapist noticing, like, hey, like, it seems like you might be struggling a bit. Are you open to me sharing some things? So I think the biggest thing for me is, like, of course, if you are going to help or talk to someone about it, I think always asking them if they're okay with that. Because I do find sometimes I've had clients say, she just kind of like, I was surprised that this individual was just like, I think you have like postpartum depression. You said she's a therapist. So like, always getting consent. I think that's pretty common in all fields. But I do think, like, if you know that your client or patient has previous mental health concerns or like ongoing things like anxiety or depression, even neurodivergency, PTSD, any of those things, like, those are a risk factor. So I think it is worth mentioning. And it's just like a kind of passing way of like, hey, like, mental health, there are services out there just to help you like plan and prepare for that time when baby is here and you might need some extra support or need to make a plan. And there are, I think, resources that I've been working on, but also that I want to be sharing with community shortly, about just like quick checklists that even if like, I'm noticing these things, it might be a nice idea for me to maybe check in with that patient and see if they're needing extra support. But yeah, I think the psychoeducation piece is the most accessible, I think, also for other practitioners, because there's so many resources online. There's like info sheets or just like sharing about it and talking about it. So like, any piece of psychoeducation, I think, is like the starting point, because again, like I said earlier, you can't really do much about something if you don't even know it could be an option, like a possibility of happening.
Yeah. And what would you, for those maybe that aren't familiar with the term psychoeducation, like, do you
Okay,
delve
yeah.
into
Sorry,
that
I
a
use
little
that
bit more?
so I use it
No,
so
no, that's
freely now
okay.
because, yeah, so when we say psychoeducation and therapy, for me that's a big piece, but what I mean by that is, essentially, say the topic we want to talk about is mental health postpartum. So if I was to be doing psychoeducation with a client, it would look like me explaining what postpartum depression is, what the warning signs look like, how we can cope with this, what are different options, when is it important to seek like crisis care, emergency care. And then also a big piece of that is like, how do we prevent postpartum depression? Like, how do we put things in place so that maybe, we can prevent it altogether, or we can make sure it's not as severe, or again, we can learn the warning signs. So it's really teaching people about specific, not even just diagnoses, but like mental load. Like, someone might not know what the mental load is. So like, I might do a session or part of a session just explaining from kind of beginning to end, like, what does mental load mean? What can it look like? How can we reduce it? So it's really just going through kind of all the aspects of that specific topic.
I love that. I feel like we all need a handout with those things
Yeah.
on them that we can give
Yeah.
our clients. That's so interesting about preventing postpartum depression. So tell me more about that. Do you feel that it really can be prevented, or at least reduce the risk of?
I think we could definitely reduce the risk. I don't ever want to make causal terms because I'm not
Yeah,
like
of
in the
course.
research field, of course. But I do think, and just from, again, I'm not doing research, but seeing clients go from like maybe their first baby to their second baby or telling me about their experience in their first pregnancy and postpartum to their second, and like how they integrated therapy with that second pregnancy maybe, but they didn't even know it was an option with the first one. I do think we could prevent things from getting so, how do I say this? Being so severe with postpartum depression. I'm just using that one diagnosis as an example, obviously. But I think if we were to say, sit down in a therapy session and we're able to plan out, like, who can you call if you're feeling overwhelmed? Like, who is your support system? How can you split things up with your partner or husband or whoever, your support circle is, so that you're not feeling overwhelmed and isolated? And inevitably, maybe you do end up feeling those feelings because, hormonally, that is the thing. Like on the physical level, like our hormones are doing crazy things when we're postpartum. Do you have someone you feel comfortable talking to? Do you think it'd be important to have like counseling sessions pre-booked every 2 weeks, maybe postpartum, and then you can kind of book them out, space them out more and more as you start feeling better? Are you getting out of the house? Is sleep going okay? Is there a way you can plan that? Maybe I'm going to breastfeed during the day and then we're going to bottle feed at night, or are there patches in the day where you can get sleep? So like, I think a lot of things like postpartum depression and postpartum anxiety are heavily reduced when we try to work with people before they're happening and put a plan in place to really, take care of those main pillars of our health of like, we need to eat, we need to sleep, we need support, we need connection. And then we also just need people to talk to. So I think if we can actually look at those things, talk about those things, and make a plan, I think I've seen a lot of those things be reduced. Unfortunately, the second time around, because a lot of the time, the first time around, people aren't really aware that like, oh, this could be a thing. But again, the more I talk about it, the more, you talk about it. We do podcasts like this. We, post on Instagram, or we just talk to people in the community. I think there's becoming more of an awareness of like the importance of that.
Yeah, the plan is so important. Even I think someone who maybe historically hasn't struggled with mental health, how are you when you're sleep deprived? How do you feel? Do you know that this is a real thing that people struggle with? And
Yeah.
how can you and your partner or your support system work together to help with sleep? Or you talked about the mental load. I know
Yeah.
that I'm sure can be a big contributor to this as well. So maybe we can use that as a segue. Tell me more about the
Yeah.
mental load and how it contributes to postpartum depression and other postpartum and perinatal mood disorders.
Yeah, so just a little sidebar to the previous topic. Just quickly, I just want to mention it because I know a lot of people look at taking care of yourself as all of this fluffy, beautiful 3 hours at the spa and all these things. I always want to remind people to keep, first of all, I hate the term self-care now because it's overused, but taking care of ourselves, like let's make sure that when we are planning to do it, the plan only works if it's realistic and attainable. So always remind people, like, it might not be your ideal, but what is realistic and what could be helpful? It might not be an hour in the gym, but it might be a 15-minute walk outside. So sorry, I just wanted to make that kind of disclaimer because I think sometimes we get into like planning these elaborate things. And if we can't attain them, then we're kind of just back at square one with feeling like we're not doing anything to take care of ourselves.
I think that's a good point. I think there's so much pressure too nowadays on all the things we should be doing for our health. We need to exercise X amount. We need 7, 8 hours of sleep. We need to take all these supplements. We need to get enough protein. We need to be doing our physio. We need to be going to therapy. And it's just so overwhelming. And so I really like that of, okay, what's actually realistic and attainable? And one small action compounded over 365 days can actually make a big difference for a lot of people, versus when we think we have to do all of these things and then we just get overwhelmed and we don't do any of it.
That. I've been there. So I'm like, I'm still learning my lesson. Like, I feel like I'm just getting to a place where it's like, okay, I can't do a full workout today, but I have 20 minutes to run. So I'm going to go run. Or, okay, I can't work out today, but I need to meal prep anyway. So let's make some like intentional decisions with meal prep. Or I'm just going to sit outside because I have 10 minutes and it's sunny. The vitamin D is good for me. Like, making those small things to just feel like you're filling your cup a little bit goes such a long way.
Yeah. Thank you for highlighting that.
Can you repeat the question about mental load, because I forgot what it was now?
Yeah, no, just how, tell us more. Okay, what is the mental load? Because I think I mean, I don't want to say buzz term necessarily, but hearing it a lot more. And I think
Mhm.
it's really good for people to understand what it is, what it looks like, and then also how it contributes to postpartum depression and perinatal mood disorders as well.
Yeah. So mental load is a big term. I think that's the piece that gets me every time I try to define it because it's like hard to do concisely, but I'll do my best. So there's obviously the things that we're doing in everyday life as since we're talking about perinatal period. So as, parents, there's a lot we're doing, right? But the mental load is really referring to, yes, we're doing, but on top of that, the individual that's carrying most of the mental load is also anticipating what's upcoming. They're planning what's upcoming. They're like doing risk assessments on like the danger of the things that are upcoming for the kids. So it's mostly relating to the cognitive tasks that the default parent, and the default parent, again, another term that we use a lot, is the parent that is maybe doing a lot of or most of, taking care of the kid. And a lot of that falls on the mom the first year because moms usually are on maternity leave if it's a traditional situation. So the mental load refers to all that background. I talk about it like that background administrative work that goes into doing the thing. So like using this podcast as an example. This is us doing the podcast. Like we're sitting here, we're talking to each other. But I can imagine, on your end, there's all these other things that have to happen before we could sit down to do this. And I had, yes, one or two things to do, but like the mental load for you for the podcast was probably much greater because you have a lot of things, you have editing, you have all those things to do after. And like that's how I kind of would describe, like that's like that administrative piece of making all the things happen behind the scenes so that the actual action can take place.
It's like all the open tabs on your computer, right?
Yeah.
I'm someone who's like a million open tabs all the
Yeah.
time. I'm like, this is a representation of my brain.
And
Yeah.
so, yeah, I don't know if I would, like, I'm sure there is research to prove that, like, the mental load, of course, I think is associated to anxiety and postpartum depression. But I kind of look at it as its own category in a way, because for me, when I work with clients, it's like when people's mental load is too high, like, they're burnt out. They're like way over capacity. They have like no window of tolerance. And again, I'm using all these terms. Window of tolerance is kind of like there's this area where you can kind of tolerate, good, bad, sad, mad feelings. And then there's sometimes like almost like you kind of go numb or stop functioning. That's the low, like when you're out of the window of tolerance at the bottom. And then that kind of explosion or, like that angry outburst that might happen if you kind of pop the lid off your window of tolerance. And so, of course, all of those things do relate to postpartum depression and postpartum anxiety because at a basic level, if we're not taking care of ourselves enough, these things are way more likely to happen or be more severe.
Yeah, it's almost like that window of tolerance. You feel like you're drowning, I'm sure, the way you're
Yeah.
describing it. And one more thing on top of that just sets you over the edge.
Yeah. And I hear a lot like when we look at partnerships in general, so two people have a child together, a lot of that mental load falls on the person that's home. And it's not even like either partner has decided that that's going to happen. But I think one partner just assumes because that person's with child most of the time that they are taking care of everything. But they don't see like the stress of, okay, well, for example, I need to make dinner. Okay, but the baby has a nap. I need to make dinner, but I also need to go to the grocery store if I'm going to make dinner. I have to make sure the baby has their nap. I would like to get some kind of walk-in. Oh yeah, I forgot, like those bills came in the mail. I need to pay my bill. I need to go to the doctor. What are we going to make for lunches tomorrow? Do we have enough? Like there's just this ongoing list that just kind of eats you up from the inside, kind of like you said, like you're like slowly as the tasks pile up, you're just like, I don't even know how to get out from under all of this.
Yeah. Yeah, I was going to say, can you talk me through a day, like speak out loud of all of the things that might go through a parent's head, the default parent's head in a
Yeah.
day? You gave us a sample, but that's probably only like 30 seconds in someone's brain,
Yeah,
right?
I mean,
Yeah.
from morning to night, that would might take up the rest of our podcast here talking
You
about
know,
it. But I think it just pertains to like all the needs of the baby and then all the needs of your house. And then again, if you're back at work, then all the needs of you being back at work. You also have a partner, so you're trying to meet your partner's needs. And if you have other kids, you're trying to meet their needs. And then you have a social circle. And so it's like all of these things are falling on you to make all these choices about. And I think with this culture of hyper independence being the new thing that everyone's striving for, or maybe not so much now that everyone's like learning that you can't do it all and be it all and be really great at everything all the time. But I think it almost came from that piece of like, I can do it all. I should do it all. It's shameful if I don't do it all or I can't. So I'm not going to ask for help because I shouldn't need help when realistically we were never meant to raise children alone. Like when you look at history, and evolution and all those things. Like, it was never one person or maybe two people, like one person going to work and one person being home doing it alone all the time and doing everything else.
Yeah. Well, and also, I mean, nowadays too, with the world and life being so expensive, it's very
Yeah.
rare that one person can just stay home. So you've got your potentially your default parent who then also needs to go back to work maybe earlier than historically has or has at all. So that's another piece.
And what
So that I
typically
guess,
happens, sorry, with that brings up, I just talked about this in a workshop recently, is what happens when that default parent, and I'm going to say mom because that is what it is majority of the time, but it could be either parent. When the default parent returns to work, these systems are already so ingrained from the past year of that person just doing everything. And like when we talk about it, it sounds like, oh, that's easy enough. Just like talk about it and redistribute the responsibilities. But it becomes such a pattern that like that person continues to do everything and the other person just continues to feel like it's probably fine because they would have said something if they needed help. But what a lot of people don't understand about this mental load is that asking that default parent to then ask the other parent every single time they need something is again another thing that they have to do. And
yeah.
so depending on their situation, they might say it's just I'll just do it myself. Like it's easier. But it's really not. So I always suggest, and couples laugh at me for this when I work with parents, but I'm like, I'm serious. Every Sunday, have like a 20-minute meeting of what the week looks like and like who's doing what and where could you use support? Where could I use support? And like, where can we etch out some time together? Do we have time to like spend some quality time together? And at first they're all like, that is like way to take the romance out of all of it. But then they are like, oh, that actually kind of works because we've now carved out that time instead of just like almost hoping that time will come up where we can do all these things. And the resentment goes down because we now both know what we're going to be responsible for. And if we need help, we could ask each other, but we've been able to split it up in a way that both feels good to both of us that we probably won't need to.
Yeah, that's a good point. And what would you suggest around preparing for the mental load and in pregnancy? What's your approach to that when you work with people prenatally?
Yeah. So what I do with a lot of people is, of course, I see a lot of pregnant individuals coming in alone at first. And then I would say like 95% of the time, the piece of like, I don't know how we're going to juggle it all comes up. And so traditionally, there's couples therapy and then there's individual therapy. But I do sometimes invite the partner in for a one-off session to sit down and like talk through who's going to be responsible for what, right? Like in this first phase, realistically, if mom is recovering and she's trying to really tend to baby, like what can you pick up? Like of course you can't, maybe if mom wants to exclusively breastfeed, of course you can't do that. Like you can't help with that piece in terms of doing the actual breastfeeding, but like, could you make sure her pump parts are washed? Could you be the one that's making sure, the dishes are done and like taking on more of that household piece so that she could really focus on, getting her supply up for breastfeeding, like whatever the goal might be. And then we kind of look at, setting it up in a way where like I have this list, I could share it with you too, of like all the things that it's like probably not exhaustive because there's always something else, but like of all the things that can come up when it comes to mental load in that first 2 to 3 months. And we sit there and we literally make a plan of like who's going to be responsible for this, and not a plan so that everyone's perfect at it, because of course like I'm sure there's a day where dad's exhausted and he's like, I just can't do this thing. But like, it's just something to hold the structure in place so that she doesn't feel overwhelmed by all the things that she needs to do on top of being postpartum and caring for this new baby, but that you also don't feel like you have to ask her, because that's the number one complaint I get. It's funny, a couple of sessions, women saying, he'll always come up to me and say, what can I do to help you? And the women are always like, why don't you look around and just do what needs to be done? And so that's another tool I give guys is like practice walking into a room and going, what? And I say guys generally, of course it could be a woman too, but like what could be done in here that would be helpful?
Mm-hmm. Yeah,
Right.
I'm sure this tends to play out more in more like heterosexual couples, would you
Right.
say?
Yeah,
Yeah,
I would
just
say
kind of
so.
the traditional gender roles and, I
Are
think we've
kind
come
of
a
in
long way in
place
that.
just by the world being that way. But
Yeah.
yeah, it's interesting when it's like, because we sit down and make that plan in those traditional relationships, the dad's usually like, oh, like half of this, it's not even that hard. I just wouldn't have even thought to do it. And it's so funny because it's like, and that's the piece that it's funny because that's the piece that almost frustrates the mom is like, he wouldn't have thought to do it. So then he would have came to ask me and it would have annoyed me that he can't just do it. So having those conversations beforehand prevents that like new mom having to also be the manager of the house of like assigning duties and stuff. And the
Yeah,
more
I think
dads
there's
do it, the more it becomes natural, just for the rest of their kind of relationship, like into raising their kids together.
Yeah, and I think even just that level of awareness. I love that you have a list. I want to see it. I want that
Yeah.
handout because I don't think a lot of people even recognize everything that goes into a day
Yeah.
that's needing to be done or decisions being made. And so that level of awareness, I think, is a huge first step to
Yeah.
help with too.
And it's
Like I
funny
didn't even
because
know.
it's funny. I'm a perinatal therapist. I remember the other day my husband came home and I was like, okay, so I meal prepped. I did all the dishes. I did 3 loads of laundry. I cleaned the bathroom, something or other like that. And I was like, okay, I'm going to go get ready for work now. So like you're on the kids kind of thing. And he was just like, how do you do it all? Like, how do you do all of that? And I was like, almost like, again, that awareness of like, I think being home more, you just see it more too. So you're like, that needs to be done. That's been sitting there for that long. There's no food in the fridge. The laundry's piling up. So of course, the person who is home more is going to see it more. But how can we help that non-default parent kind of recognize that, hey, if the laundry basket's full, just throw it in the washer. You don't have to ask.
Yeah.
Yeah.
Yeah, yeah. That's great. Yeah, I think the conversations around the mental load is huge. And what do you feel kind of limits the default parent or the person carrying more of the mental load from giving away some of that? Because I think that's part of it too. I mean, correct me if I'm wrong, but I think part of it is maybe a lack of awareness, but also part of it sometimes too is we get entrenched in our habits and our patterns.
Yeah.
And, we can't
Bingo.
put it all on the other partner, right?
Yeah.
There has to be that willingness to give up. And I think sometimes we tend to I mean, correct me if I'm wrong, but do we tend to hold on to that on some level too?
Yeah. So there is a term, it's maternal gatekeeping of like, there's a big long definition for it, but essentially like part of that definition is that like we like things done the way we've done them and we want you to do them how we do them, especially when it comes to baby, right?
Yeah.
So it's almost easier if I just do it myself because that'll make me feel better. But with household things too, it's like I like the way I do it better. So unless you're going to do it like I do, it's almost easier for me to just do it. And I think I talked about this again in my last workshop that I did. I try to do community events around the community just to, again, do that like education piece around all this stuff. Talking about we can't totally fault the other parent because we also, when they are practicing noticing, we also have to practice letting go and like trusting that we picked the right person to do this whole raising children thing with, that they will find their own rhythm and how they comfort the baby or how they feed the baby or, whatever it might be with the baby. But then also for household tasks, like, yeah, maybe you don't like the way they load the dishwasher, but if it means you don't have to load the dishwasher and the dishes are coming out clean, does it really matter? Like, is that something we could compromise the control on? And so I do a lot of that, like challenging clients in session of like, you gotta pick, you can't have both. You can't control it and then not complain. You can't control it, but then struggle with having to do everything. We have to let it go. And I think it's such a unique period, especially postpartum. A lot of individuals who have just had babies feel such a lack of control and autonomy over their body. And like, I have this baby now and everything's about baby. My sleep's about the baby. Like, if I'm allowed to leave the house, I have to make sure the baby's fed. And they've just lost all this control over, their fitness routines and their diets and their routines with household chores that gets really emphasized. So they grip on tighter to the things they can't control. So we almost have to do like some of that exposure therapy of slowly being like, why don't why don't you go for a 30-minute walk and leave baby with, it could be dad, it could be grandma. And it might feel a little uncomfortable, but was baby safe when you came home? Baby was happy? Like, you got to do those little exposures to like get yourself in a place where you're feeling more comfortable with them.
Yeah. Yeah. Those are such good points. And I
Yeah.
think that's a big piece of the mental load that maybe a lot of us don't realize.
Yeah.
So it's a two-way street and it takes both partners to work on, I think.
Yeah.
Yeah. Amazing discussion. I'm sure we could talk about this all
All
day.
day. Yeah.
But if people are interested in connecting with you and learning more about this and also working preventatively, proactively on their mental health, what's the best way for people to get in touch with you?
Yeah, so I do have an Instagram if people just want to learn more about my approach and what the kind of things I work on, and that is just at Jeevan Counselling. And then my email is very similar, so if people want to reach out via email, it's at Jeevan jeevan@wellcounseling@gmail.com. And then I also have a page on Psychology Today. So if people want to either leave a voice message or they want to send me an email through that platform, they can just go to psychologytoday.ca and type in my name with the city, and my profile will pop up with some more information on how I work. And yeah, it's a good way to get in touch.
Awesome. I'll share those in the show notes. Thank you
Awesome.
so much for joining us, Jeevan. This was such a great chat, and I hope we can maybe meet again and do another episode on some more things around perinatal mental health. So thanks everyone for tuning in to another episode of TMI Tuesdays. I hope you have a great rest of your week, and we'll see you again next Tuesday. Bye.
Bye.
Thanks for tuning in to another episode of TMI Tuesdays. Women's health is complex, nuanced, and deserves better conversations. If this episode resonated with you, I would absolutely love if you followed and subscribed to the podcast on Spotify and shared it with someone who might need to hear it. We'll see you again next Tuesday.